there. I recently had an interview with a Russian channel and many asked me to translate it in English. So instead we decided to make a whole new interview where I will try to answer the same questions I was actually asked then. Those questions typically asked me in the office every day. So let's begin. My name is Elena Blackburn. I'm a physician. I was trained in Riga, Latvia as MD and practiced there as well. I also had training at NCNM, National College of Natural Medicine here in Portland. I had a fellowship in regenerative medicine in United States, and also was trained in Paris several months for the aesthetic medicine procedures, which unfortunately I can't use in United States as much because of not all of them FDA approved. However, I had a wonderful time, wonderful experience, and absolutely fabulous training there. I practiced aesthetic medicine for about 19 and a half years. So some people ask me if I can inject with closed eyes, and I think I can, but I didn't try it and I don't think I will. One of the most popular questions I had: what age should you start doing aesthetic procedures? The answer is it depends. Sometimes you should start at 25, 26, and if nothing bothering you, if you feel and look good, then you don't have to start it until you think something has to be done. Often I'm asked, what is Botox? What is Botox or Xeomin or Dysport? All of those ingredients, all of these things are very similar to each other. They are all muscle relaxants. There's two types of wrinkles, dynamic and static. Dynamic wrinkles are easy to relax. Typically they happen to younger people. Static wrinkles are there when your face is in a relaxed position. And I describe relaxation of static wrinkles typically like that to my patients. So if this is your skin and this is your muscle, even though if I relax your muscle right now, your skin still will be a little bit wrinkled. In order to relax skin, you need to use Botox on a regular basis, and it could be every 2 months, every 3 months, every 4 months. It's very individual time, and you would know that time if you'll start doing Botox. Also with aging, this time is actually going to be shorter and shorter. Many people don't know the difference between Botox and facial fillers and other things like PRP and microneedling and stuff like that. So I'd like to answer those questions right now. The difference between facial fillers and Botox is that Botox is muscle relaxant and fillers are filling the tissues which we actually lost. For example, like fat tissue underneath the skin. So that's what fillers do. They fill those gaps in the tissue. There's so many different fillers existing on the market. And I'm not going to go even over them, but my favorite ones are Radius, and I also like very much Restylane. Radius I use for deeper filler, right? For the mid part of the face and for the jawline. It's a calcium hydroxyapatite filler. It stays in your skin and your tissues the longest. However, it can be only used on top of the bone. That's why it could be used on particular places. The other one I use is the Restylane. Restylane can be used for the lower and upper face rejuvenation. It's very soft, nice, very pliable filler. There's also Juvederm. People asking me for Juvederm. Juvederm, good filler as well, but I prefer the Restylane. It works the best. It works the same as other fillers. However, it's very optimally priced as well, and it stays in your tissues optimal time. Pretty much the same as the Juvederm. When somebody comes to my office, they typically don't know anything about the procedures I'm about to do. So I always draw the face on a piece of paper and explain them what I see on their face. Then we make a treatment plan, and then based on the treatment plan, they would tell me what are they comfortable doing today. people afraid that it's going to be very painful. The procedures itself could be less or more painful, depends on your pain tolerance. It also depends on your cycle and depends on your hormonal status and many other things. However, there's lidocaine exists, such anesthetic, which you can put topically on your skin right before the Botox, and 20 minutes before I would inject you with Botox, and it would be much more comfortable to do it with lidocaine if you're afraid of pain. Fillers have lidocaine inside them, so even though I always typically put some lidocaine on your skin, when it's injected, it's not really painful because it's already pre-anesthetized. Another procedure people ask me for is PRP, especially if you're looking to make your skin thicker, younger, tighter. This procedure uses a little bit of your blood growth factors to be re-injected in your skin and to boost collagen and elastin productions. It may look very scary for some, because actually I'm injecting you with your own blood, and it's the liquid which I inject actually really pink. But it is very natural, and there's almost no side effects procedure. Uses both chemical and mechanical way to rejuvenate your skin. It's actually very good, and I love the procedure very much. As a physician, I always do comprehensive evaluation of your skin when you come to my place, to make sure that you possibly don't have any beginning of melanoma or any other skin cancer, because this would be a complete contraindication, 100% contraindication for any kind of rejuvenation procedures. Since rejuvenation, it means dividing cells, and wouldn't be a good idea if you have melanoma. I would love to see you in my office. However, if you're not ready yet, or if you don't have a time to stop by, I would love to give you one good advice what you can do at home. There is such thing as microneedling device. It's very little roller with needles. Needles can be different size. What you can do to make your skin tighter and boost collagen and elastin productions at home, you can use it twice a day on your skin. But there's two main things I need to mention with the roller. First of all, you have to use a sunblock if you use it in the morning right after the procedure. And the second thing, you need to make sure that the roller is clean. So you have to use it, maybe alcohol or peroxide, depends, to clean the roller, not to spread any kind of infections. After roller you used, it's best to apply some serum, which would actually go into these little holes that roller made on your skin, and rejuvenate your skin even better. The reason I recommend the microneedling, because there's only two ways to regenerate your skin. One is mechanical, making holes in the skin, that's one of the ways. Second one is actually chemical. So when I do peels in my office, or you apply some kind of serum on top of those little holes you just made, this would be chemical boost for your collagen and elastin production. Another wonderful way to rejuvenate your skin with chemical boost is the VI peel. I do that in the office, and that's the only peel I recommend, honestly. You don't have to do it more than once or twice in the whole year, and you really peel for about 3 days at home, but your skin is looking so much better, and the acne scars and the brown spots and all these imperfections on your skin getting so much better. Often I get a phone call with a question: how much money does it cost to rejuvenate your face if you're not used to doing anything with your face? Typically, I would say it's about $1,000. If I would, let's say, use it to relax 3 areas on your face, and maybe 1 syringe of cc or milliliter of filler, just to start with. And it's not necessarily needed to be done in one day. It can be done in different visits. However, it could be done in one day, and It's called lunch hour rejuvenation, where you come to my office and in 40 minutes time I can beautify you with Botox and filler. People are very, very happy afterwards. I recommend this kind of rejuvenation, this lunch rejuvenation, if you don't have to go anywhere today. Otherwise, I would say postpone it a couple days, because sometimes there's bruising can happen, especially if you taken any kind of blood thinning medications, supplements, or anything else. All those procedures can be done to females and males, but there's some difference in how I inject males. Doctors, physicians typically know that you need to make a difference between female and male face. As I already mentioned, I practice regenerative medicine. It means not only aesthetic medicine, it means optimization of your health, internal and external, optimization of your nutrition, of your hormonal status, making sure that your joints working well. I use PRP not only on the face, on the skin, but also inject them inside your joints. And it's actually a miracle treatment for many, since they don't have to use the knee replacement as often, or at least not now. With PRP treatments, I also do pellet therapy hormonal pellet therapy for males and females. It's a wonderful way to rejuvenate your hormones, and all kinds of other procedures for you to feel and look good. Friends, if you have questions, please don't hesitate to contact me via email or phone. Our phone number 541-238-2108. You also can email me to agamedical@outlook.com. More information is always available on our website, www.wiredwellness.com. Thank you.